1. What is the primary goal of therapeutic communication in mental health nursing? A. To provide advice to the patient. B. To establish a trusting relationship with the patient. C. To reinforce the patient's delusions. D. To control the patient's behavior. Answer: B. To establish a trusting relationship with the patient. Rationale: the primary goal of therapeutic communication is to build a trusting relationship that allows the patient to express emotions safely. Option A is incorrect because providing advice is not always therapeutic. Option C is incorrect as reinforcing delusions is unethical. Option D is incorrect as controlling behavior is not the goal. 2. A patient with schizophrenia states, "The government is controlling my thoughts." What is the best nursing response? A. That must be very frightening for you. B. You should ignore these thoughts. C. The government is not interested in you. D. Why do you think that? Answer: A. That must be very frightening for you. Rationale: acknowledging the patient's feelings without reinforcing the delusion is the best response. Option B dismisses the patient's experience. Option C contradicts the delusion, which may cause distress. Option D may encourage further delusional thinking. 3. Which medication is commonly used to treat bipolar disorder? A. Fluoxetine. B. Lithium. C. Haloperidol. D. Buspirone. Answer: B. Lithium. Rationale: lithium is a mood stabilizer used to treat bipolar disorder. Fluoxetine is an SSRI used for depression. Haloperidol is an antipsychotic. Buspirone is used for anxiety. 4. A patient experiencing a panic attack should be: A. Left alone until the episode passes. B. Encouraged to use slow, deep breathing techniques. C. Asked to discuss their fears immediately. D. Given a stimulant medication. Answer: B. Encouraged to use slow, deep breathing techniques. Rationale: slow, deep breathing helps calm the nervous system. Option A is incorrect because patients need support. Option C may increase anxiety. Option D is incorrect because stimulants can worsen anxiety. 5. What is the most important safety intervention for a suicidal patient? A. Encouraging group therapy. B. Placing the patient in seclusion. C. Removing all potentially harmful objects from the environment. D. Asking the patient to promise not to self-harm. Answer: C. Removing all potentially harmful objects from the environment. Rationale: removing harmful objects reduces the risk of self-harm. Option A is helpful, but not the primary safety measure. Option B may increase isolation. Option D is not a reliable prevention method. 6. A patient with depression states, "I feel hopeless and want to die." What is the nurse's priority action? A. Ignore the statement to avoid reinforcing suicidal thoughts. B. Ask the patient if they have a plan to harm themselves. C. Tell the patient to think positively. D. Change the subject to something cheerful. Answer: B. Ask the patient if they have a plan to harm themselves. Rationale: assessing suicide risk is a priority. Option A ignores the patient's distress. Option C is dismissive. Option D avoids addressing the issue. 7. What is the priority nursing diagnosis for a patient experiencing alcohol withdrawal? A. Risk for self-harm. B. Risk for injury. C. Ineffective coping. D. Social isolation. Answer: B. Risk for injury. Rationale: alcohol withdrawal can cause seizures, making risk for injury a priority. Other options are relevant but not the most urgent. 8. Which side effect is most concerning with clozapine use? A. Sedation. B. Weight gain. C. Agranulocytosis. D. Dry mouth. Answer: C. Agranulocytosis. Rationale: agranulocytosis, a severe decrease in white blood cells, is a life-threatening side effect of clozapine. The other side effects are common but less dangerous. 9. A patient in the manic phase of bipolar disorder is pacing and talking loudly. What is the best intervention? A. Confront the patient about their behavior. B. Encourage the patient to sit quietly. C. Offer a low-stimulation environment. D. Force the patient to take medication. Answer: C. Offer a low-stimulation environment. Rationale: a low-stimulation environment helps reduce agitation. Confrontation: A. May increase aggression. Option B is unrealistic. Option D violates patient rights. 10. Which symptom is characteristic of PTSD? A. Flashbacks. B. Euphoria. C. Increased energy. D. Hallucinations. Answer: A. Flashbacks. Rationale: PTSD is characterized by intrusive memories and flashbacks. The other symptoms are not typically associated with PTSD. 11. What is a key sign of lithium toxicity? A. Diarrhea and tremors. B. Increased appetite. C. Hyperactivity. D. Constipation. Answer: A. Diarrhea and tremors. Rationale: early signs of lithium toxicity include diarrhea, tremors, nausea, and confusion. 12. A patient with OCD is repeatedly washing their hands. The best nursing intervention is: A. Forcing the patient to stop. B. Allowing the behavior without limits. C. Setting time limits for hand washing. D. Ignoring the behavior. Answer: C. Setting time limits for hand washing. Rationale: setting limits helps manage compulsions while reducing anxiety. 13. A nurse is teaching a patient about fluoxetine. What is an important side effect to monitor? A. Increased suicidal thoughts. B. Hypotension. C. Dry mouth. D. Muscle rigidity. Answer: A. Increased suicidal thoughts. Rationale: SSRIs can increase suicide risk, especially in young adults. 14. Which intervention is most appropriate for a patient experiencing auditory hallucinations? A. Telling them the voices are not real. B. Encouraging reality-based activities. C. Asking what the voices are saying. D. Providing reassurance without addressing the hallucination. Answer: B. Encouraging reality-based activities. Rationale: reality-based activities help distract the patient and reduce hallucinations. 15. Which ethical principle is violated when a nurse shares patient information without consent? A. Autonomy. B. Beneficence. C. Confidentiality. D. Non-maleficence. Answer: C. Confidentiality. Rationale: confidentiality protects patient privacy and should not be breached without consent. 16. A nurse notices a patient with depression is not eating. The best approach is: A. You need to eat or you'll get sicker. B. Can you tell me why you aren't eating? C. I'll leave your food here if you change your mind. D. If you don't eat, I'll have to report it. Answer: B. Can you tell me why you aren't eating? Rationale: open-ended questions encourage discussion and problem-solving. 17. What is the priority intervention for a patient having a panic attack? A. Encouraging deep breathing. B. Offering food. C. Asking about childhood trauma. D. Telling the patient to calm down. Answer: A. Encouraging deep breathing. Rationale: deep breathing helps regulate anxiety and panic. 18. A nurse suspects a patient has been abused. What is the priority action? A. Ask the patient directly about abuse. B. Report suspicions to authorities. C. Wait for more evidence. D. Ignore it unless the patient mentions it. Answer: A. Ask the patient directly about abuse. Rationale: direct questioning helps assess safety. 19. What is a negative symptom of schizophrenia? A. Hallucinations. B. Delusions. C. Flat affect. D. Paranoia. Answer: C. Flat affect. Rationale: negative symptoms include a lack of emotional expression. 20. A nurse caring for a suicidal patient should prioritize: A. Providing a safe environment. B. Encouraging independence. C. Discussing long-term goals. D. Offering group therapy. Answer: A. Providing a safe environment. Rationale: safety is the highest priority in suicide prevention. 21. A patient with major depressive disorder shows no improvement after weeks of medication. What is the next step? A. Increase the dosage immediately. B. Stop the medication. C. Consider alternative treatments like ECT. D. Add an anxiolytic. Answer: C. Consider alternative treatments like ECT. Rationale: electroconvulsive therapy, ECT, is considered when medication fails. Increasing dosage, A, or stopping medication, B, without medical supervision is not appropriate. 22. A patient with schizophrenia is experiencing command hallucinations. What is the priority nursing action? A. Ask the patient what the voices are saying. B. Tell the patient the voices aren't real. C. Ignore the hallucinations. D. Ask the patient to focus on reality-based activities. Answer: A. Ask the patient what the voices are saying. Rationale: command hallucinations can be dangerous if they instruct self-harm or violence, so assessment is crucial. 23. Which of the following is an example of a cognitive distortion in a patient with anxiety? A. I always fail at everything. B. I will try to do my best. C. I can improve if I practice. D. I know I have strengths and weaknesses. Answer: A. I always fail at everything. Rationale: cognitive distortions involve negative and exaggerated thoughts. Always statements are examples of all-or-nothing thinking. 24. What is the most important nursing intervention for a patient with anorexia nervosa? A. Allow the patient to skip meals if they refuse. B. Monitor vital signs and electrolyte levels. C. Focus on appearance to encourage eating. D. Provide laxatives if constipated. Answer: B. Monitor vital signs and electrolyte levels. Rationale: anorexia nervosa can lead to life-threatening electrolyte imbalances, so monitoring is critical. 25. A patient with PTSD is having a flashback. What is the best response? A. You're safe. This is not happening now. B. You need to stop thinking about the past. C. Tell me more about your trauma. D. You should try to move on. Answer: A. You're safe. This is not happening now. Rationale: grounding techniques help reorient the patient to the present. 26. What is a common defense mechanism in patients with addiction? A. Intellectualization. B. Denial. C. Projection. D. Sublimation. Answer: B. Denial. Rationale: denial is a common defense mechanism where individuals refuse to acknowledge substance abuse problems. 27. A nurse is assessing a patient with Alzheimer's disease. What is an expected symptom? A. Rapid mood swings. B. Increased energy levels. C. Progressive memory loss. D. Enhanced problem-solving skills. Answer: C. Progressive memory loss. Rationale: Alzheimer's disease is characterized by gradual memory loss and cognitive decline. 28. Which intervention is best for a patient experiencing severe anxiety? A. Encouraging deep breathing exercises. B. Providing detailed explanations of procedures. C. Asking the patient to make important decisions. D. Leaving the patient alone. Answer: A. Encouraging deep breathing exercises. Rationale: deep breathing helps reduce anxiety. Complex explanations or decision-making can worsen anxiety. 29. A patient is on an MAOI. What food should be avoided? A. Chicken. B. Bananas. C. Milk. D. Eggs. Answer: B. Bananas. Rationale: MAOIs can cause hypertensive crisis when combined with tyramine-rich foods like bananas, aged cheese, and wine. 30. Which symptom indicates serotonin syndrome? A. Hypotension. B. Muscle rigidity and hyperreflexia. C. Weight loss. D. Depression. Answer: B. Muscle rigidity and hyperreflexia. Rationale: serotonin syndrome is a life-threatening condition characterized by hyperreflexia, tremors, fever, and autonomic instability. 31. What is the priority nursing action for a patient with a history of violent behavior who becomes agitated? A. Use therapeutic communication techniques. B. Physically restrain the patient. C. Administer a sedative immediately. D. Ignore the patient's behavior. Answer. A. Use therapeutic communication techniques. Rationale. Early intervention with communication can de-escalate agitation before restraint or sedation is needed. 32. A patient with schizophrenia has flat affect and social withdrawal. What type of symptoms are these? A. Positive. B. Negative. C. Cognitive. D. Mood-related. Answer. B. Negative. Rationale. Negative symptoms include diminished emotional expression, withdrawal, and lack of motivation. 33. A patient with bipolar disorder is experiencing mania. What is the best nursing intervention? A. Encourage large social gatherings. B. Provide a low-stimulation environment. C. Allow the patient to direct their care. D. Engage the patient in lengthy conversations. Answer. B. Provide a low-stimulation environment. Rationale. Reducing stimuli helps prevent escalation of manic symptoms. 34. Which medication is commonly used for alcohol withdrawal? A. Haloperidol. B. Disulfiram. C. Lorazepam. D. Fluoxetine. Answer. C. Lorazepam. Rationale. Benzodiazepines like lorazepam help prevent seizures and manage withdrawal symptoms. 35. Which patient is at highest risk for suicide? A. A 35-year-old woman with mild depression. B. A 21-year-old male with previous suicide attempts. C. A 50-year-old man with chronic anxiety. D. A 40-year-old woman with PTSD. Answer. B. A 21-year-old male with previous suicide attempts. Rationale. Previous suicide attempts and being male increase suicide risk. 36. What is a priority nursing action for a patient with antisocial personality disorder? A. Set clear limits on manipulative behavior. B. Encourage dependency on staff. C. Provide extensive emotional support. D. Allow the patient to break minor rules. Answer. A. Set clear limits on manipulative behavior. Rationale. Patients with antisocial personality disorder often manipulate. Clear boundaries are essential. 37. Which neurotransmitter is primarily involved in depression? A. Dopamine. B. GABA. C. Serotonin. D. Acetylcholine. Answer. C. Serotonin. Rationale. Serotonin plays a major role in mood regulation, and its deficiency is linked to depression. 38. Which statement by a patient with borderline personality disorder, BPD, suggests improvement? A. I still feel empty, but I know it will pass. B. Everyone either loves me or hates me. C. I always get abandoned in relationships. D. I don't care what anyone thinks. Answer. A. I still feel empty, but I know it will pass. Rationale. Recognizing and tolerating distressing emotions is a sign of improvement in BPD. 39. Which intervention is most effective for a patient with OCD who engages in excessive hand-washing? A. Forcing the patient to stop washing hands. B. Encouraging gradual exposure therapy. C. Ignoring the compulsion. D. Telling the patient the behavior is illogical. Answer. B. Encouraging gradual exposure therapy. Rationale. Exposure therapy helps patients manage compulsions without increasing anxiety. 40. A patient states, I have nothing to live for anymore. What is the nurse's priority action? A. Ask if the patient has a specific suicide plan. B. Offer reassurance that life will get better. C. Encourage the patient to talk to friends. D. Suggest the patient engage in a hobby. Answer. A. Ask if the patient has a specific suicide plan. Rationale. Assessing suicide risk is the priority intervention.